sono i patient reported outcomes e come possono essere utili per la gestione dei pazienti con malattia di Fabry? Lo chiediamo al dottor Bojan Vujkovac, che abbiamo incontrato qui a Milano in occasione di un evento di aggiornamento proprio sulla malattia di Fabry. Dr. Vujkovac, what are the patient reported outcomes?
Patient reported outcomes are usually the reports from the patient itself, which should not be changed by anyone. So it's a really subjective form of interpretation of symptoms and problems they have, and that's how we collect them to see what are their issues regarding the disease.
Could you give us some practical example of patient-reported outcomes in Fabry disease?
For example, for Fabry disease, like usually they report problems on pain, on depression, on anxiety, on physical conditions, mental conditions they have, the problems in school, the problems, limitation at work, in daily activities, and so on. So actually, there are symptoms we know they have, but what we don't know individually how much they are important for each individual patient.
And why they are important, and how can they be used in the management of Fabry patient with Fabry disease?
They are important not only because the regulatory offices require that, but also because that's the way that we actually also, to satisfy our patient. It's not just the clinical data which are important. Sometimes you can have perfect clinical data, but they are not feeling well. So we have to address those issues why they are not well, and because this is also the meaning of our treatment is also to feel patient that he's better, not only treating the laboratory tests that has no meaning.